Good evening, everyone. Can everyone at the back hear me okay? Yeah, all good? All right. Welcome, everyone, to Capital Health Network's second Practice Connect event for 2025. Practice Connect events are our face-to-face networking events for practice managers and practice nurses, covering a range of continuing professional education. My name is Katerina Levantis, and I'm the Workforce Planning and Prioritisation Project Officer here at CHN. And I'm excited to be facilitating tonight's event. I would also like to introduce the other members of the quality improvement team here tonight. We've got Michaela to my right, we've got Charlene and Kunal over here. Rachel and Kate were also outside. Alrighty. Before we get started, I would just like to do an acknowledgement of country. So I would like to acknowledge the traditional custodians of the land we're meeting on tonight and pay our respects to their elders past, present and emerging. I recognise their ongoing contribution to our region and communities and their connection to land, water and culture. I also acknowledge and welcome all other Aboriginal and Torres Strait Islander people joining us this evening. Just for a bit of housekeeping to get started, bathrooms are out the door and to the left. If you would like to go, just grab one of the swipe passes so that you can swipe back into the door. In the event that we need to exit the building, please head to the right past the kitchen through the fire stairs at the end of the office there. Lastly, you were all allocated a little dinner box for your meal. So if you haven't already grabbed one, please feel free to at the end, or you can quickly run and grab that now if you'd like. So I'm going to provide a quick update from Capital Health Network before we jump into the main content of the evening. Just quickly, for those of you who are not aware of our referral platform, Health Pathways is a free platform for primary healthcare professionals that provides condition-based assessment, management and referral information localised to the ACT and Southern Eastern New South Wales. We've got an expert team of clinical editors who are always keeping the referral pathways relevant and up to date. And we've heard feedback from practices it's particularly useful for registrars and doctors new to Canberra. So to create an individual login, simply head to actsnsw.communityhealthpathways.org. Next, you may have already heard of it. MySay is CHN's community engagement platform. Since its release about 6 months ago, it's a wonderful way for us to engage with community members and organisations to share their views and experiences on key topics and issues, and to help improve primary health care services here in the ACT. There are regular opportunities to provide feedback and ideas to help inform CHN's program and service planning. And we're currently seeking feedback on digital health this month. Next month, we'll be seeking feedback on lung cancer in line with the National Lung Cancer Screening Program launch. To register, head to mysay.chnact.org.au and have your say. We've also got some postcards here tonight that you can also grab if you'd like to distribute them to patients or to staff. And a reminder as well, practice health checks. These are our practice visits run by the quality improvement team that aim to gather feedback from general practices so that we can better understand the primary care situation in the ACT. These visits also allow our team to provide tailored support to individual organisations. So if you're yet to complete your practice health check, simply respond to our email invite that we would have sent you, or feel free to just come and grab one of us at the end and we'd be more than happy to schedule that in with you. We'll now move on to the practice incentive program, the reason that we're all here tonight. So I will introduce our speaker, Michaela. Michaela is our Quality Improvement Project Officer. Michaela has worked in this role for the past 18 months, providing quality improvement and digital health support to practices across the ACT. Michaela also has a clinical background as an acute care physiotherapist, working for the past 5 years across both New South Wales Health and ACT Health tertiary services. Her clinical interests include intensive care physiotherapy, chronic disease management, and education and clinical supervision. She's also currently studying a Master of Public Health with a focus on data-driven improvements. So let's all give a warm welcome to Michaela. Look at this, and pinch this. Beautiful.
Can you hear me okay, Charlene? Great. Can everyone hear me up the back? Excellent. Firstly, thank you to Kat for the very kind introduction, and I'd just like to say my own welcome to everybody for coming this evening. It's nice to see some familiar faces in the audience as well. As mentioned, my name's Michaela. I'm one of the QI project officers here at CHN, and I'm excited to be presenting this evening on the Practice Incentives Program. There's quite a bit to get through tonight, so we might just jump straight into the content. Great. So the Practice Incentive Program, or the PIP as it's often referred to as, is an incentive program that's run by the Department of Health, Disability and Ageing, but it's actually administered by Services Australia. The suite of incentives that are offered under the program support general practices to provide quality care, enhance capacity and improve patient health outcomes. The program includes 7 separate incentives under 3 streams, and those streams are the quality stream, capacity stream, and rural support stream. But tonight I'm just going to focus on the first 2 because for the third rural stream, it's less applicable to our area. It focuses on modified Monash areas 3 to 7, which excludes the ACT. Great, so I'll just start off with the general eligibility requirements for the PIP program as a whole. As I move through tonight, each separate incentive has its own requirements in addition to these. The general eligibility requirements require practices to be accredited or be registered for accreditation against the RACGP standards for general practices. Practices need to have a current accreditation certificate or be accredited within 12 months of their application, regardless of if any extensions are given by your accrediting agency. The practice needs to be open and have 1 or more medical providers providing health services at the main physical location of the practice. You'll notice a small star there for that one though. In exceptional circumstances, such as natural disasters that cause the practice to close for a period of time, the practice can apply through Services Australia for an exemption for this point. Practices also need to maintain at least $10 million in public liability insurance cover for each practice location, and professional indemnity insurance cover for all GPs and nurse practitioners that are part of the organisation. For full details on the general eligibility criteria, practice staff can access the Practice Incentive Program guideline on the Services Australia webpage. So how do practices apply? If practices meet the general eligibility requirements, they can register for the PIP online through HPOS via their Proda account. Practices will need to fill in some paperwork, so that includes the PIP ownership and declaration form and the PIP individual GP or nurse practitioner form. They also will need to provide a current accreditation or registered for accreditation certificate and evidence to support your ownership structure, which must include the practice as part of that structure. Once the practice is registered for the PIP, each individual incentive can then be applied for through PRODA. And just a note, if you need to register a new practice and it used to be previously registered for the PIP by the former practice owners, you cannot do this through HPOS. So the system will return a message that says the practice address may have been previously registered. Please contact PIP for further assistance. And then you'll need to visit the Services Australia webpage for further instructions on what to do from there, because that will require a manual registration. So let's jump into each incentive now, starting with the Indigenous Health Incentive. The Indigenous Health Incentive provides support to general practices for Indigenous health services so that they can provide best practice management of chronic disease and mental health for Aboriginal and Torres Strait Islander patients. This incentive has 2 payment types. There used to be 3, but one of those has been phased out, the registration component. So the first payment is the sign-on payment, which is a one-off $1,000 per practice payment. And then the second is outcome payments that are tiered and dependent on the service provided. So tier 1 payments are $100 per eligible patient per 12-month assessment period, while tier 2 payments are $300 per eligible patient per 12-month assessment period. Tier 1 payments are made for eligible MBS, chronic disease management and mental health items, and may be a combination of either initial plans and reviews or just reviews, depending on the timing on when they've happened over the assessment period. We'll circle back at the end, but we do know that MBS changes are coming for these item numbers. So we have a little bit of information at the end for those ones. To be eligible for the Indigenous Health Incentive, practices must provide a few things. The first is proof that there is a system in place to make sure Aboriginal and Torres Strait Islander patients with chronic disease are followed up. So that's whatever recall system the practice is using. They also need proof that appropriate cultural awareness training has been completed. What does appropriate mean? That involves at least 2 staff members from the practice, one of which must be a GP, completing the training within 12 months of the practice signing on to the incentive. They also need to complete an annual ongoing confirmation statement, and at the end we'll jump into what you need to do for that and what an ACS is. So that's our first incentive. The second is the Quality Improvement Incentive. The Quality Improvement Incentive, or the PIPQI, supports general practices to undertake CQI through the collection and review of practice data. This may be where you've met some of our team members in the past. PIPQI payments are calculated per standardized whole patient equivalent. This is your SWPE, which presents the fraction of care provided to each patient weighted for age and gender. And there are some guidelines available online as to the breakdown of exactly how that's calculated. But practices receive $5 per SWPE, capped at $12,500 per quarter or $50,000 per annum. To qualify for the PIPQI payments, practices must participate in CQI activities in partnership with their local PHN, that's us in our team, and share their PIP eligible data set to their local PHN. And I'm hoping that everyone in the room by now is aware that we are transitioning to a new data extraction tool in July. Polar is the tool that's offered by Outcome Health that we'll be using from July onwards for practices to share their data with us, which is important for maintaining your eligibility to get your PIPQI payments. Practices must also again complete the annual ongoing confirmation statement. That's just one statement across the incentives, but is required. And must also maintain evidence of CQI activities for 6 years, subject to auditing from the department, which hopefully most practices would already have records of for their accreditation process, just making sure you're hanging on to those somewhere in case of auditing. Next up, we have the after hours incentive. The after hours incentive supports practices to provide their patients with appropriate access to after hours care. Payments are made in a tiered structure depending on the level of after hours service provided and also based on the SWPE. It's important to note though, some payment levels don't require the practice to provide care themselves. If a formal arrangement exists for patients to access care through a third party, then you could still be receiving some form of payment under this incentive. For the practice incentive program, the complete after hours period includes outside of 8 a.m. to 6 p.m. on weekdays, outside of 8 a.m. till midday on Saturdays, and any time on Sundays or public holidays. But this is further broken down into sociable and unsociable hours. So sociable are considered between 6 p.m. and 11 p.m. on weeknights, and then essentially any other time is the unsociable after hours period. In addition to meeting the eligibility requirements for the incentive, practices must also nominate an authorised contact person to confirm on the practice's behalf changes to information for PIP claims and payments. Ensure that the information in the National Health Services Directory, so Health Direct, is current at all times. Keep documentary evidence, including evidence of their formal after-hours arrangement to support claims for payment. Give information to the department as part of the ongoing audit process to prove that the practice has met the eligibility requirements. They need to make sure the information given to the DHDA is correct and inform the department about any changes to practice arrangements at least 7 days before the relevant point in time date. So that's important as we're coming up to payment cutoffs, that you need to update that information a week in advance. Next up, we have the eHealth incentive. The eHealth incentive supports general practices to keep up to date with the latest developments in digital health and adopt new technologies as they become available. To be eligible for this payment, practices must have healthcare identifiers, so a HPIO and HPIIs integrated into their electronic medical records system, so whatever clinical information system you're using. Have standards compliant secure messaging capability. Be working towards recording the majority of diagnoses electronically. So this is your clinical coding within your clinical information system. And that needs to be using a nationally recognized disease classification or terminology system, for example, SNOMED. They also need to ensure that the majority of prescriptions are sent electronically to a prescription exchange service, and use compliant software for accessing My Health Record System so that they can upload shared health summaries for a minimum of 0.5% of the practice's SWPE count of patients per PIP quarter. Next up is the teaching payment. The teaching payment supports general practices to provide teaching sessions to undergraduate and postgraduate medical students in Australia. To be eligible for payment, practices must meet the general eligibility criteria of the PIP program, provide eligible teaching sessions, and to be considered an eligible teaching session, it must be provide to a student enrolled in a medical course accredited by the Australian Medical Council at an Australian university, provided to a student enrolled at an Australian-based campus aimed at preparing the student for the Australian medical profession, be part of the student's core curriculum, so it can't be something additional or elective, given by a GP who's registered in the PIP at the main or additional practice branch location when the teaching sessions took place, given by a GP responsible for the session, including sessions outside the home, so this is like home visits, and they must be a minimum of 3 hours in length. If these requirements are met, then practices will be paid $200 per 3-hour session with a maximum of 2 sessions per GP per day. Before students attend, the university must complete the university certification section of the teaching payment claim form. And after the teaching session has been completed, both students and the GP must complete the form and provide a copy to the university. I'm just very briefly going to touch on the procedural GP and rural loading payments, but won't go into too much detail because both of these incentives are only available to practices located in rural, remote, and metropolitan areas classified as areas 3 to 7. But these payments aim to encourage quality patient care in rural and remote areas. The procedural GP payment is a payment for GPs in rural and remote areas to provide eligible surgical anaesthetic and obstetric procedural services, while the rural loading incentive payment is for a practice whose main location is outside of a metropolitan area. I wanted to touch very briefly today on the Workforce Incentive Program, which is often lumped in with the PIP program, but is technically separate. The Workforce Incentive Payment, or the WIP, improves access to quality medical, nursing, midwifery, and allied health services. It is separate to the PIP, but similar in many ways. And most practices in the ACT would be familiar with the practice stream, which is an incentive payment to general practices to support a multidisciplinary team-based care model. Again, the incentive is based on the SWPE, the type of health professionals employed, and the average hours worked, but the maximum amount for the WIP payment has increased to $130,000 per practice per year. That's a lot of information to take in. A couple of extra slides to go just on, I guess, a few areas where practices may get stuck or reasons why Services Australia have declined to pay practices in the past. So, to manage PIP quarterly payments, practices can check PIP online for their quarterly payment advices in HPOS in February, May, August, and November. So a calendar reminder or whatever helps you remember to check those would be helpful around those dates. If you log in and you have not received the respective PIP quarterly payment advice, then you can contact the incentive programs at Services Australia to let them know. And if any details are not correct in the payment advice and you cannot update them online through HPOS, then you need to contact Services Australia and provide them with any relevant signed forms at least 7 days before the current PIP quarter point in time date. There's some examples up there because that will need to be manually processed. If any details are not correct, then they should be updated online through HPOS on or before the current PIP quarter date in time, so the 31st or 30th of the month. So if they need to be manually processed a week before, if you're able to update them online, you have till the end of the month. As mentioned before, most of the incentives require you to complete your annual confirmation statement. You can do this by checking PIP online through HPOS. They usually come out around May for them to be submitted by the end of June. They will be online when you log in on HPOS. We're very aware that practices get lots of notifications through HPOS, and that might be drowned out by other updates you're receiving. Services Australia won't send an email version of this, but some practices do elect to have it sent in the mail. So best to have some kind of reminder set up around May that you need to go on and resubmit this statement if you don't have capacity to check every notification that you get through HPOS. If it's not there, once again, you need to contact services, and if the details are incorrect, you also will need to contact them a week beforehand if you can't change them online yourself, by the end of the month if you are able to change them online through HPOS. And that all has to be done before the 31st of July. Okay, some common reasons why Services Australia might suspend payments to practices. So if you fail to complete and submit the annual confirmation statement that we just spoke about, if you don't meet any of the eligibility criteria that we've just had a chat about, if you don't achieve accreditation within 12 months of joining the PIP for a new practice or a newly accredited practice, if the practice relocates and an updated accreditation certificate isn't provided to Services Australia in time for the new location, if the practice no longer employs a GP, if there's a change of ownership and the updated information isn't provided to Services Australia in time, if practices allow their accreditation to expire or there is a lapse in accreditation dates, if there are significant changes to practice details that Services Australia haven't been notified about, if providers or other eligible health professionals at the practice do not have the required insurance, or if Services Australia have been provided with incomplete or inaccurate practice details. So how do you know whether you're actually receiving your payments or not? Through everybody's favorite HPOS. So you should be able to log in and view the My Programs tile in blue. Under My Programs, there's a Practice Incentive Program tile, which will take you through to the PIP Online main screen, where you can then click the Update section in the bottom right-hand corner. That will take you through to the Practice Summary main menu, and then there's an option in your left-hand bar there that says Payment History. That's where you can click through and look at your payment advice under PIP Payments. Once you click through to there, it should open a PDF, and it will have, once you scroll down a fair way, a list of the incentives that you're registered for and how much you were paid for each incentive. So if you're registered but not receiving a payment, it will say Indigenous Health Incentive $0, for example. And that's how you can check whether you're getting paid or not. Okay, as I mentioned earlier, we know that some changes are coming to MBS items for chronic disease management. So a couple of points to touch on today. We know that from July 1st, GPMPs and TCAs are being replaced with a single GP chronic condition management plan, which they're now calling a GP-CCMP. For patients that have an existing GPMP or TCA in place prior to the 1st of July this year, there is no immediate action required. Details of the new item numbers are available on MBS online, but do note that if you try and search for these item numbers in MBS, they don't have their own page yet. That's yet to go live. For patients who are registered through My Medicare, they will be required to have their GP initial plan done and their review items done through the practice they're registered at. But for patients who are not registered for My Medicare, they can still access these item numbers. Patients will still have access to their 5 individual allied health services per calendar year, or if they're of Aboriginal or Torres Strait Islander descent, they'll be eligible for 10 visits with allied health. But the requirement to consult with at least 2 providers is no longer, so it's acceptable now to just refer to one allied health provider. Yes, okay. While these plans don't expire, patients must have their plan reviewed within 18 months to be able to access their allied health services. And whilst plans can be billed every 12 months, so an initial plan can be billed every 12 months, they're not required to be. So with the idea that your My Medicare registered patients will only come to you to have their plan done, you set up the initial plan. From there, you can continue to review instead of starting a new plan every 12 months. And that's in line with the remuneration changing so that reviews are remunerated slightly higher than they were in the past. And where can you find out more information about the changes that are coming? So MBS Online is quite helpful. We're expecting more information to go up under each item number soon. Our webpage has some information up there, and it's also got our practice incentive program quick tip for anybody who didn't grab one tonight. So if you're looking for more information about the PIP, you can find some there as well. And the Department of Health, Disability and Aging webpage also has some information about the upcoming changes. Then lastly, I did want to mention that the National PHN My Medicare Working Group are releasing a toolkit to help practices with the upcoming changes, and this is set to be released in July. The working group has also requested that the department runs a webinar for practices as an opportunity to ask further questions about the upcoming changes. And we're still waiting for a response back from the department. But once that is confirmed, we will let everybody know through our fortnightly newsletters that go out. And if any webinars are confirmed with the department, they'll go up on our events page as well for more details there. In addition, any resources that come out through the PHN My Medicare Working Group will be disseminated through our newsletters. I know that was a lot to take in, so thank you all very much for your attention this evening.